would like to give the presentation for our INIGIMA Cloud Diagnosis, which is from IEEARC Technologies Private Limited. I'm a founder and CEO of IEEARC Technologies, and along with me, Dinakaran is there, who is the co-founder and CEO, and Dr. Bhavana ma'am, who is a clinical research director. So today we'd like to give the presentation about how we are going to solve one of the problem and with the NCD. So we know this NCD progression is a very complex and the slow process, like NCD, like diabetes, blood pressure, cardiology problem, and obesity. So these kind of condition slowly convert into a deadly condition, like we know the heart attack, stroke, and the kidney failure. So one day you suddenly visit to the hospital and the doctor says to you, we need to go for the bypass surgery or we need to go for a dialysis condition. So this condition, which is triggering here around the 30 years or the 40 years young generation, it is not happening within a one day. It's a gradual process which is keep on triggering into our body. Some physiological changes are getting started. Then after that, this deadly condition is coming. Addition to that, nowadays the COVID impacted a lot, and the long COVID we have seen created the alarming stage of the sudden heart attack, stroke condition. So we know after the COVID-19, this situation is also going to increase. The cases of the type 1, type 2 diabetic cases are also getting increased. So that is why these problems are very important to solve. So what is the problem with the healthcare ecosystem that we have identified? The unstructured and unorganized healthcare data. We have transformed from this hard copies of the file and converted into a scan copy and converted into a PDF, Word, and image file. And now this extraction of the data is a very important part to get that meaningful information out of it. So this is where the patient is unable to get any kind of diseases management system. They are lacking in the predictive analytics, and also enterprises like pharma, life sciences unable to retrieve the meaningful information of it. So here we have the solution is a digital twin. It is a data-driven SaaS platform actually, which is replicate a physical body into digital information completely. It's like we are trying to map each and every minute information in our platform. In addition to that, we are tracking their physiological changes in environment, and in addition to that, the variation and the trend. So this relative study is going to be help us to understand what is the complication of the patient at right now and what is going to be created in the future. So we are getting that structural machine learning data set in our platform to extract the meaningful information, to derive certain, like to improve the medication process also, and adhere to the treatment, what is the doctor is going to prescribe to them. So this is our platform look like, and it is the kind of, we have closely monitor the patient. The doctor can access through their own dashboard, and instead of the doctor who is going to read that year of information, like 45 minutes, it will going to be 45 seconds it will going to take to read this complete year of information. Rather than downloading the PDF and the Word file, he can extract that information very easily. So what is the value addition for the patients? The data-centric approach we are taking, which is making that patient healthier, happier, and achieve their longer life. That is our main motive. So we are connecting the patient to our health coaches, so they can get connected with them and adhere to the treatment for a longer time and the lifestyle modification. So we are trying to track each and every changes which is going to be happen after the medication, which is going to prescribed by the doctor as well.